right, meet superbug. This is what happens when we don't use our antibiotics appropriately. He is resistant to every antibiotic known to man, and in honor of Halloween, I thought you could meet him. This is also my prototype for next year's costume, but don't tell anyone. All right, so the buzzword around town that you might hear from your medical professionals is antimicrobial stewardship. You've probably heard about antibiotics. Antimicrobial is just antibiotics, and antifungals, which treat fungal infections, and antivirals too, which treat viruses. So now you know what antimicrobial means. In stewardship, you've probably heard that when it comes to finances, using your finances wisely. So antimicrobial stewardship is using your antibiotics wisely as well. So antimicrobial stewardship is using the antibiotics wisely at the right time, when you need them, at the right dose, for the right amount of time. So we know from previous studies that we aren't using our antibiotics appropriately. We're using them in the hospitals and in our community settings too long and in too many of them. The CDC estimates that drug-resistant bacteria are causing major illnesses and harm in our communities, and most of this is due to overuse of antibiotics. So they've set aside a week in November, and that's one of the reasons we're talking about this today, to get smart about antibiotics. There are lots of materials available. There's a website link on here, but if you just Google CDC and get smart, you can find a lot of educational materials that you can give out to the public. Everybody has access to this that talks about what you can do, why you want to use antibiotics, what viruses are, that everybody can learn about what antibiotic resistance is, why we're creating superbugs, and that picture that we saw, and how we can use antibiotics appropriately. So we were having eggs and we're talking about issues. So what are the issues? Well, we're overusing our antibiotics, right? So what does that mean? Well, we're using them for longer than we probably need. We're educating our prescribers that we can use them for shorter times. The longer you expose the bugs that you have in your body to different antibiotics, the longer they have to adapt to those antibiotics and develop resistance mechanisms. Also, if we give you more than one antibiotic, then you can also develop resistance. Or if you use an antibiotic for a viral infection, so when you don't need it, or if you use a Z-Pak when you have a cough, then you can develop resistance. We don't have enough new antibiotics that are coming down the market. Some people get other infections from being treated by their antibiotics. You might have heard of something called C. difficile. It's a type of diarrhea. You can get that from being treated with antibiotics. Also, it's not all prescribers' fault. Some of this is in your food. They treat animals with antibiotics as well. So you have to globally look at the issues. So this is a really busy slide, but it's in the news everywhere. Bad bugs, no drugs, what are we going to do? And this slide over here shows our antimicrobial approvals from 1983 to 2011. So we don't have a lot of new antibiotics coming down the pipeline. Unfortunately for us, there's not a lot of new treatments coming for the things that we're treating with antibiotics. This is really concerning, and the government is starting to take notice and get on board. They've published a new national action plan in 2014 and 2015 that targets this. So the national action plan was published by our government that is focusing on improved antibiotic stewardship, prevention of drug resistance, and elimination of use of growth-promoting antibiotics in animals as well, which is awesome. Also, the Joint Commission that accredits our hospitals and CMS, which is the Medicare and Medicaid services, are putting new regulations in place for our hospitals to meet so that we're all focusing now on antibiotic stewardship. So what are we locally doing about this problem? Well, Haywood Regional started an antimicrobial stewardship committee. I helped to lead that committee. We also have a lab test available called procalcitonin levels. A lot of hospitals don't have this, and that's something that's really great about Haywood. It helps a prescriber distinguish between a viral infection and a bacterial infection. It can't tell you all the information, but it gives you a little more information for our prescribers. We're also educating people. That's one of the reasons I'm here, but I also make a lot of these talks to our prescribers as well. So how are the community effective? Let's talk about those Z-packs. We know that if you go to the doctor's office, about 60% of the times you say you have a sore throat, your doctor's going to give you an antibiotic. But only 10% of the times you actually come up positive for a strep test and you actually need one. If you go for bronchitis symptoms, so we've got a cough and I really think I need that antibiotic, well, about 73% of the time you're going to get an antibiotic, but 80% of the time you actually have a virus. So that's an issue, and that's where we're running into problems. The more you're exposed to antibiotics, the more likely we are to develop resistance. And we're really seeing these issues in all of our patients now. We have nothing left to treat a lot of the patients that are coming to the hospital. So, antibiotics aren't always the answer. Most of the time, viruses are causing things like your colds and your runny noses, bronchitis, especially coughs and congestions. The main thing is listen to your doctors. We're talking to them too. But if they say, hey, I really think this is a virus, listen to them. The things that are caused by bacteria generally are strep throat, urinary tract infections, but viruses can cause ear infections as well. So what can you do to prevent antibiotic resistance? Well, only take your antibiotics when they're prescribed. Take them for the right amount of the time. You may see shorter courses now, only 5 days, where you used to see 10 days or 14 days. Don't use your leftover antibiotics or give them to your friends who you think have the same thing that you just had, even though you have them left over. Make sure that you are washing your hands and keeping your vaccinations up to date. So in conclusion, antibiotics were a gift that we have had wonderful results with. I think they're probably the best thing. If we look at the chart of mortality data, how has our death rates decreased from antibiotics? It is amazing. But we're going to lose that if we don't take action now to help preserve what we have. We want that gift to be left for our children and future generations. So it's really important for us to use our resources wisely at this point. If we use antibiotics appropriately now, we can help to prevent antibiotic resistance for the future.